Hospitals that are not part of a university, a health system, or a chain of private hospitals are often called community hospitals. They stand on their own, and they are dedicated to the people who live in their own backyard, and there are big benefits to that relationship. From Licking Memorial Health Systems, I'd like to welcome Rob Montagny, the president and CEO, as well as Pat Jeffries, chairman of the board of directors. Thanks for being here, gentlemen.
Good morning.
Thanks for having us.
All right, Rob, let's go back a little. I found this kind of crazy. Licking Memorial has been around since 1888.
Correct.
That is a long time. So do you think, I mean, that whole commitment to community, was that really the reason that it was created?
A lot of community hospitals are inspired because they've been created by their communities to serve their communities, and I think we are the same. Well over 100 years, as you've mentioned, that we've developed a relationship with our community, and that is our inspiration and our mission. As a matter of fact, we're there to improve the health of our community. So making sure we collaborate with a lot of the other nonprofits, making sure community we are.
It's not just excellent medical care. I mean, you guys establish yourself and make sure that you benefit the community in so many more ways than that, right?
Absolutely. I think you would find in most of the counties in the state that the health systems or the hospitals are one of the largest employers, so you certainly have an economic responsibility, but it goes so much further than that. We do a number of things with local schools, local churches, like I said, other local community organizations to make sure that we are effectively really changing the community well outside of the healthcare realm, and that's what feels so good about being a part of a community hospital.
And I think one of the great things inside of the medical care is that when you're a community hospital, you can do a lot to keep down things like cost, like wait times, a lot of the things that people really look for when it comes to good medical care.
The accountability that comes with being a part of a community hospital, I think, is what's so rewarding. We get that constant feedback, we get that immediate feedback from so many in our community. And the other thing we're able to do is we're able to leverage the outstanding of our community, like the individual that's with me this morning. We have so many talented folks who give of their time to help us succeed, like Pat Jeffries and our other board members. And I think in a community to take advantage of that is just so critical.
So Pat, what is your role on the board of directors?
Well, as chairman of the board, it's a matter of coordinating, some of the activities and being there as an input source for Rob and his staff, and to kind of talk about the policies and procedures and things that go on at the hospital.
And what are some of the specific kind of community benefits that you guys are able to offer?
The hospital has a long history of giving back to the community, and as Rob mentioned, our mission is to improve the health of the community. And there are so many of them, that just to mention a couple of them. For example, giving out the 12-lead EKG technology to our ambulance services, and that allows them to get data back into the hospital before the patient even arrives, so they can be on top of those kind of things. And we've supplied defibrillators to our government offices, to our local law enforcement vehicles, and to our schools. And as I mentioned in the earlier segment about now's the time for sports.
Sure.
And one of the things that we do that we feel very good about is free physicals that go out to people who, and along with the free, you've heard a lot about concussions and things like that. We give free EKG screenings. We give concussion screenings to any middle school or high schooler or band member or anybody else who's involved in these sporting activities. And these are all things that we do to kind of give back to the community.
That's huge, big for those parents. So how does the health system's leadership really decide upon, what specific initiatives they're going to get through to meet the community's needs?
Well, Rob and his staff do a wonderful job of paying attention to what's going on, all the public health data that's going on, and determining what are some of the unmet needs in the community. And we think that a community our size, we give out last year over $30 million in uncompensated care for things that are going on. There's an awful lot of projects that can be done. And so they determine through community input, through patient satisfaction surveys, through public health data, as to what's really necessary. And then make the determination, do we have the financial resources and the personnel to do it? And can we do it in an excellent fashion? And then determine how many people can we impact? And they make their decisions based on that and do a great job of it.
And the answer is usually a lot, right there in your own backyard. So
Yes.
Rob, let's talk about why it is so important for the health systems to really provide these programs, in addition to, as he said, that huge monetary value of uncompensated care.
Well, it's not a very complex answer. We do it because it's the right thing to do. We are, once again, mission driven, And we feel that whether it's providing free sports physicals, making technology available, like Pat mentioned, the EKGs, or the breast pumps to mothers who want to breastfeed, all those things are geared at helping individuals, families in our community to have better health, and that's what we are all about. So, as Pat said, the decision is not very difficult, sometimes limiting the things we do because we want to do so much, but obviously there are only so many things we can do.
Sure.
But just picking things that have an impact, that's really the important thing.
All right. Well, I want to thank you both for being with me, and thank you for what you do for your community every day.
It's great to be here.
Thank you for having us.